Coming at you live. Doc Talks this week, man. Z Cup, and we're talking about, do we need an MRI? This is like a big question, obviously, in our field with treatment and going through a trial of care. When is that pertinent? We have patients that come in right off the bat. Do I need an MRI? It's like some of the first questions. So we're going to try to sift through some of the do's and don'ts, what it does, what it doesn't do. So that's going to be the talk for today.
Yeah, because sometimes it can be the most important thing that we have to get for our patients, but sometimes it is unfortunately a symptom of the problem that we have at large today because of the internet. Is more knowledge isn't always better. Will help problem solve for you, so you can make an informed decision about when you should go down this route versus not.
Yeah, and the quickness though too. People want the answer like now, and as long as we check off the right boxes, that answer doesn't have to come at that exact time. As long as you're making steps towards finding a solution. So again, we're gonna talk a little bit more in depth on do's and don'ts of this. Starting off with, what does an MRI tell us? What is it actually showing us in, it's called medical imaging. There's x-rays, CTs, ultrasounds, MRIs. What else? Is there anything else there's all sorts
PET scan.
Yeah.
Haven't heard of that one in a while.
Barium swallows.
Yeah,
DEXAs. Bunch of, these are all medical imaging terms, but we're specifically talking about MRIs. Because it's probably one of the most common outside of x-rays. And what it does tell us most of the time is, as opposed to an x-ray, it'll tell us more about soft tissues. So soft tissues meaning muscles, tendons, ligaments, cartilage surfaces. All of these things can be imaged with an MRI.
Nerves too.
Nerves.
That's why they do brain MRIs, because you can
absolutely
see all of the internal structures that you might not catch in an X-ray, which predominantly is bone.
Yes. Yeah. So you'll see a lot more evaluation of soft tissue now. With X-ray, like we were just saying, it's mostly bone. You're going to see structures of bones, arthritic changes, positions of bones, how they look in relationship to the rest of the skeletal structures. So there's definitely different uses for both of those, but MRI definitely gives us a more focused look at some of the soft tissues. It can also tell us about swelling. So if there is an injury or if there's been pain in an area and you're getting an evaluation, on an MRI, we'll have, depending on which type of MRI we're looking at or which version of an MRI, you'll see a very bright area or a very dark area in spots that have more water or fluid in that area. So it can definitely tell us about internal swellings or something within the body that has a lot of water around it. So that's definitely useful.
Yeah, and it's also useful in seeing if there are things that are there that shouldn't be there. So if there's any type of tumors, any serious pathology, changes in anatomy that shouldn't be there, or sometimes should. I remember when I worked in basketball, we had an x-ray of a guy finger, or his wrist, because he had wrist pain, and he had a gap between two of his bones, and so we thought he might have tore one of his ligaments. And we're like, crap, his season's over, this guy's an NBA hopeful, we got problems. We took an MRI, and it turned out that was actually an anomaly. That was his anatomy. So, and that's not always common. He just had that spreading there, but the ligament was intact. So it can also inform you of things like that as a way of ruling out, hey, this isn't necessarily something to be concerned about.
Yeah, that's good. So anomalies, like the human body is totally different between Zach, my body, anybody else's body. If you take a picture, you're bound to find quite a difference. Just like how we look in our appearance, the insides definitely have differences if you know what you're looking for.
Although the outsides oftentimes match on these doc talks. Except this today. Except today.
Yeah, we didn't.
I thought you were going to go purple today.
No, I had to switch it up today. Okay, so that's what it tells us. It tells us about soft tissue. It tells us about pathology or like bad things that are going on in our bodies. And then what does it not tell us? I think this is one of the most important points that we'll talk about, is that it doesn't always tell us about pain sources. It can tell us potentially where a pain source is, absolutely. You'll find a tear, or you'll find a fracture, or you'll find all sorts of these findings on an image, and they can tell you about potential, but that doesn't always mean that is the source of pain. There's a lot of findings that we can see that are potentially pain sources, but they actually did research and they saw that those are found on people that don't have pain too. So we have to really combine the functional anatomy or the functional exam to a picture. We're not always just reliant on a picture.
Yeah, and you can't. And for the exact same reason you talked about in the studies you're referring to, it's like anywhere, especially in back pain, 30 to 80% of asymptomatic subjects can have some type of abnormal finding. So if you're working with a provider who's only looking at that image, and they're not taking into account what's going on with you, they may make assumptions about what you're experiencing in the relation to what's seen on the MRI. And a common time that we see this, I think, is the success rate of spinal surgery, as a prime example. So with spinal surgery, especially fusions, they do a lot of different things to change the anatomy of the spine, but if you look at the outcome rates of that particular surgery, it's not good. In fact, with lumbar fusions, it's about a 50-50 shot at efficacy. Mm-hmm. So if it was only about anatomy, that surgery would work 100% of the time. But pain is way more complicated than that.
Yeah, and I mean, especially with interventions such as surgery, you're looking at a ton of tissue damage, very deep. So there's definitely a lot of risk there. Of course, there's always going to be times when you want that, and we'll talk about that in a bit. But 100%, if it's this golden figure of a human body that we're looking for, it doesn't exist. Those things don't exist, and we have to combine what we see in an image, and we have to combine what we see in an exam, and then treat accordingly as well as we can. And that's typically what we'll use an image for if we ever order out or send out for an image. We'll look at both of those. We'll say, well, your findings on your MRI were this. Your functional exam looks like this. So I think we can either keep on going with our conservative care plan, or we need to start, maybe switching that up.
Yeah, and I think another thing too is an MRI. Just because you had an MRI done, it's not necessarily definitive in terms of the reading.
Oh,
there was do you know the study I'm talking about? There's 10. Took one MRI, mm-hmm. and they had 10 different radiologists. This was someone with low back pain. They had 10 different radiologists, so the people who are trained to read the MRI. Folks, guess how many different diagnoses there were for just this one image? There was 35, I believe, if you look at the study. I mean, I didn't even know 35 things could be wrong with your lower back. So just because you have something on imaging, it doesn't mean that it's definitive. Mm-hmm. You might have moved, and that might have changed the anatomy in a certain way, and that maybe made that appear, and it might not be there. Or you might have something that doesn't appear on the imaging, and then maybe you're someone who does actually need surgery, and they go in and they find things that they wouldn't see. Yeah. I mean, that's one reason why they'll do exploratory surgeries, mm-hmm. because sometimes you can find stuff that's not on the imaging. So to echo what Dr. Booth was saying, this is one part of a more integrated process that we look at when we're making a decision to best serve you health-wise.
Yeah, and just to clarify, most of the time an MRI is something that is going to be a picture of one point in time, and it's not going to show a lot of how your body moves too. So when people come to us and they are seeking treatment, most of the times because they can't move. So we got to treat movement as opposed to treating this picture. we obviously need the picture if things aren't going the right way, or we have some red flags come up where we're like, hey, we need to see if you're safe. But yeah, we need to make sure that we're treating the patient and not the picture. And that's typically our motto is, we want to make sure that we're giving the best movement solutions to people so that they can progress. When we actually do order out for an MRI or some other special imaging, it's usually because something has came up. One of these next topics. One would be red flags. Red flags are stuff that makes us go, holy smokes, there might be something really wrong with this patient, and we need to get them a picture as quickly as possible so that we can rule out big scary things. Cancers, tumors, big fractures, internal bleeding, things of that nature that are like they can't wait. Loss of consciousness. So those types of things are big red flags. If we were to get that on an intake of a patient, or we saw them progress towards one of those findings, whether we're asking them questions and we start to kind of have that be moved up in our diagnosis list, we're going to try to rule that out as quickly as possible.
Yeah. And that goes into another time in which we might consider doing this, and that's if there's trauma, especially if you are thinking someone has internal bleeding. Mm-hmm. And so if you were involved in some type of accident, you had a large fall, someone hit you on the street.
We just had a patient at the other location. He was trimming a palm tree. It wasn't a very big one. I mean, we're talking like 6-7 feet, but he's at the top of it, fell right onto his tailbone. And that's going to be a case where we're definitely sending out right from the get-go, because it's traumatic. There's something that you fall and you have something immediately causing pain. Yeah, those are big ones.
And that's different than if you bent over to tie your shoe and your back started hurting. That's not necessarily the same type of traumatic experience, even though that can be very painful at times.
Yes.
It's just in the case of an accident or in the case of that fall, you have a large force that's taking the body beyond what it's capable of handling. It's like, and we talked about this if you tuned into the jump one of our jump progressions that we do is we have people fall off of a box and then jump so they can get challenged beyond what their body is capable of. Same thing here when it comes to trauma. If you are involved in something that your body is beyond capable of producing, i.e. falling from 6 feet or 10 feet, then that would be a time where we would warrant some imaging.
Yeah, it's good. I mean, those are a lot of times people, try to jump to those conclusions before needed, and use those guidelines, because the last thing you want to do is go spend a decent amount of money or have your insurance get billed for an MRI. It's not cheap. Those things aren't cheap, and if you have this guideline or this context on when to get, how to get an MRI, that might save you a couple of bucks. We also I will also send out for an MRI if there's been prolonged pain, so I'm not getting where I want in treatment with a patient, and I think that I should have reached a couple of milestones by then. If I'm not seeing that and I think that I need an evaluation of soft tissue, that's when I'll go for an MRI. There's been times where I've gone X-ray instead, just because of other reasons, as the patient goes through care, and I go X-ray first. But when you have a plateau, or you have something where it's you're just not getting anywhere else, you don't feel like there's another provider that would be more beneficial at that time, then it might be time to get a picture and then get more information and then make another decision if they should keep on going with care, or there might be another person to go see.
Yeah, and the key thing that you said there, Dr. Booth, is after you've tried things for a period of time. A lot of times we'll get questions of someone who wants to come see us is, do we need an MRI before we see you? And if you don't have those red flags, if you haven't had some type of traumatic experience that led to you feeling pain, chances are we will not need one right away, because the pictures themselves will not change what we do as clinicians in terms of the specific treatment. There's not, like, we do this technique with our hands with a disc, but then if it's the next disc above, we do this one. It's not necessarily the way that we operate. What we try to do is we change your ability to move, the way you perceive pain, and we progress you to tolerate more challenging tasks, whether that's lifting something heavy off the ground or going for a sprint. What the MRI does for us is it lets us know if we are the person to best help you. Because if we need to go with an MRI, we're generally thinking you might need something that's a bit more aggressive than conservative care. It doesn't mean surgery always. It could be an injection, it could be an ablation of some sort, anything. But it's not necessarily something that's warranted before you come and see us.
That's a big point right there, especially. I maybe it's not especially with chiropractors, but I feel like dealing with the spine, a lot of people want to, hey, do you need my X-rays and my MRIs? I get that question a lot, and it's maybe it's not profession dependent, but anybody that works in physical medicine, as an actual medical provider will probably have that as one of the main questions. Do you need imaging? And hopefully there's an examination or some communication on the front end that before they answer that question, they ask you some questions. They say, well, do you have this, this, and this? Is there, trying to rule out some red flags, trying to get a little bit more information about your case, not just jumping straight to imaging and then treating the image based off of their findings there. That's what we believe is not great healthcare. It's not something that is desirable. It's not going to give good outcomes, and most of the time it kind of leads us in the wrong direction most of the time. Yeah, and they've done studies where they've compared people who've gone the route of getting imaging and all that first versus starting the rehab process earlier, and that way is way more cost effective. That way being getting the imaging and all that, or not cost effective, but it costs more to go the route of getting imaging first and then eventually ending up in rehab versus just going straight to rehab. And in a lot of other countries where there's more socialized medicine, they do studies to see if what is the most cost-effective way of delivering some type of care. And especially in the case of low back pain, Australia, I believe the UK, or it was Germany, one of those two. Both of them have decided that going the conservative route first before imaging is the new standard of care. Yeah. And they don't just do that to save money, they do that because it's not only saves money, but it also produces an equivalent or better outcome. So in most cases, try to get conservative care first. And that would probably be twofold because of, like you said, the money aspect, but then also the psychological aspect of seeing an image and getting findings of this disc looks like this has this. Those things can scare a patient, especially if they don't understand what that truly means. So it can almost deter you from getting better because, doc said I had this finding and this finding. If they don't understand that can either one heal or you can adapt to it, or that is not maybe the source of pain, then they're going to walk around connected to that new word. Oh man, I got the bulge. I got the herniation. Yep. So those things are scary for people that don't understand them, and if you've been given that, definitely challenge that it might not be the source. It might not be something that you have to live with forever. It's not always like a end all be all once you've seen some of those images or gotten some of those diagnoses. 100%. So when do you not need one? When do you not need an MRI? Dr. Couples, he was hinting at one occurrence, and this is very common for patients that they get really wrapped up in their own head because they're dealing with their pain and it is excruciating. They picked up the pencil, their back went out, and now they're in dire pain. If that is not something that causes these red flags, and again, that would be something that you would want to get evaluated first, then it's not time to jump to an MRI. So being scared about pain is pretty regular, pretty normal, especially on the acute aspect of things, meaning like right when it happens in those next couple of days. That's a pretty scary position for a lot of people. One, if you've not been in pain, or if the intensity is like just through the roof. So try not to make drastic decisions on your need for an MRI or an image at that point until you've either one, seen a provider, or two, you can kind of let that stuff take. You can get a couple of days before it starts to calm down a little bit, and then make some decisions off of that.
Yeah, because realistically, anytime there's an initial injury that happens, the inflammatory response will last anywhere from 3 to 7 days. So that's when pain is usually at its highest point, because your body is putting in all of these processes in place to help heal the affected area. And experiencing pain is actually useful in that regard because it prevents you or minimizes you moving, which could potentially cause more problems in the area. So we have to be grateful for pain in that regard. In fact, I forget what the condition is called where the people do not experience pain at all.
I don't know.
Yeah, there is a condition that exists where people have the absence of perceiving pain. And guess what, folks? They don't really live as long as you and I do. And in fact, their life expectancy is significantly shrunken. And the reason why that is because they never get any alerts to things that are going awry within their bodies. So even though pain is uncomfortable, it hurts, it can be scary, especially if you're like, oh, I don't even know what I did, right? It's not uncommon for people to get random aches and pains with no good explanation. Things will heal and things will get better if you give them time. Just like if you cut yourself shaving, like I do regularly. I've never had a cut on my face from shaving that has not healed. And same thing with any painful experience that you may have. These things will heal. You just have to give them an appropriate amount of time. And if it's not getting better within time, then that's when you want to call someone like us. Mm-hmm. And then we can kind of help guide you to, hey, do you need to actually go get imaging, or is this a bit more serious than what we're thinking?
Yeah, and we've had, I'm sure you've had hundreds of accounts of this, patients being scared when they come to see you, and they immediately want to jump to imaging to see what's kind of going on. And we're put in a funny situation sometimes because we want to make sure that the patient gets the information that they really desire at that point, but at the same time we want to protect them from not getting information that might hurt them from progressing. So we've had, just in the last week, I had guys that went golfing for multiple days in a row, really flared up a past injury. And he's like, man, I re-aggravated my back. I did more damage to it potentially. And, talking him off the ledge for 2-ish weeks, a little over 2 weeks. Now he's, he's pain-free at this point. He's able to get up out of bed. He's like, he's doing well. So, we definitely have to make sure that we take ourselves away from the situation for a second, step back and let people that have been in that situation, or they've worked patients through those situations, give them their best line of knowledge and their best suggestions, and then see what happens from there. And if you need information on how to pick someone that can help with that, we have done a doc talks on how to pick the right provider. It's very useful to go through those check boxes and make sure that those providers are doing those things right. And get an evaluation and get someone professionally to look at you before you go off into MRI and image land.
Yeah.
It's kind of scary. It's like looking up things on Google. It's not fun.
Yeah. I mean, the one thing that we have is a lot of information, but we don't have a good way to filter that information. And finding a provider who knows these domains around pain, but they can also put it into a context that makes sense to you is really important. And and that can prevent you from getting yourself or someone in a situation where they go down a route that they don't need to. They develop beliefs or thought processes that are hindering their ability to recover, and they get just stuck in the system and have no way of getting out. And that's really what we try to strive and prevent by nipping you in the bud and getting you here.
Cool. So again, we're trying to give you guys better tools, better ammo for when to make decisions medically and how to get help with that. So if you guys need anything,
if you are someone who needs some providers to help you get through the scariness that is pain of any kind, you're wondering if you need any imaging or not, give us a call at 702-558-2151.
Down there somewhere.
It is down there somewhere. Or you can find us at elevatesph.com. Check us out there. And you can sign up for a free discovery session just to talk to one of us for 30 minutes. So if you're like, do I get the MRI? Do I come see you? We can answer that very quickly in that short time period, because what we do is we'll check to see if you have those red flags. If you don't, then we can help you.
Yeah. So if you have those questions, reach out. If not, tune in next week. We got Doc Talks coming at you again. We will see you then. Signing off.
Take care.